we're live. Hey, this is Bobby Clue with the Somerset-Pulaski County Chamber of Commerce. Back at it again for another one of our virtual ribbon cuttings. Very excited to be out in our medical community today. I'm here with Dr. Mary Catherine Carell Worth.
Yes, born and raised in Somerset.
A lot of people probably know Mary Catherine from her days as maybe a former Miss Kentucky.
Yes, that was a chapter in my life.
And now is a dentist here in her Children's Dentistry. So we're over here, and let's give everybody a geographical location where we're at. So we're on Bogle. We're in the Bogle Office Park.
Bogle Office Park Drive.
So what's around us right here?
So it's off of Bogle Street, so in relation to the hospital.
Right behind the hospital, basically.
When patients are asking for directions, we always say stoplight number 10, turn onto Bogle Street, take a left on Bogle Office Park Drive, and you'll find us.
Yeah, it's pretty easy to find. The Commonwealth Cancer Center is right there. We've got, you said that's the bariatric office right there. So pretty easy place to find. A beautiful building right here, and Children's Dentistry. So.
Yes, and I was fortunate with our building. We didn't build it planning that COVID would happen, but I'm grateful that we have as much space so that we can accommodate and separate and meet all the guidelines.
Well, we're really excited to have you
I'm glad you
in
came
town.
out.
Full
Yes.
disclosure, I've known Mary Catherine since we were kids, so very excited to have you back in our community, you and your family.
It is nice being back. I moved when I was 18, and we've only been back in Somerset 2 years now, or living here. So it's nice to be treating and working with the people in our community.
So your husband's a dentist. Your dentist is a
oral and maxillofacial surgeon. Yes.
Yes.
So,
and you have 5 little boys.
5 rambunctious little blonde-haired boys, but they're fun.
So how fun is that? I don't know how you do it. It's basic. It's really impressive.
It's chaos every day.
Sure. Well, so tell us, why children's dentistry? Just, I understand with 5 kids, you're probably saving a fortune. But why children's dentistry?
So I'm a pediatric dental specialist. I'm not a general dentist or family dentist. I actually had special training for pediatric dentistry, and probably more training than most pediatric dentists because I have 2 residencies under my belt plus a fellowship. So I did a lot of training in University of Kentucky and then also in New York. I was at Cohen Children's Hospital and then Long Island Jewish for my medical. I did adult dentistry also for a little while. So a lot of education and training, but glad to be back in Kentucky.
Yeah, and it's another great component. I like to tell people all the time that this is kind of a medical hub for this part of the state.
It is. We service a lot of other counties, and and we specialize in comprehensive care for the pediatric patient.
Sure.
So comprehensive dental care.
What kind of care do you provide in the children's dentistry realm?
It's everything. I say tots and teens and everything in between, but it's also infants.
Okay.
And they may not have teeth yet, but the parents have concerns about feeding, nutrition, tongue ties, lip ties. So we see them as newborns on up through adolescence and into teens.
Sure, it's probably interesting. Our 6-year-old, all her teeth are falling out right now. She barely
teeth
has
fairy,
any.
right.
It's costing us a fortune. But she's lost a lot of her teeth, and I'm sure that there's a teeth health. Our 2-year-old, she's got teeth in, and where she's maybe not the best brusher.
Right. So the care that we provide is routine comprehensive care from dental cleanings and checkups to just routine cavities, drill and fill, have a filling, maybe a crown, a tooth extraction, and even small surgical procedures. In addition, with the pediatric training, we have a lot of anesthesia modalities that we offer to patients that maybe can't do it awake in the office because going to the dentist can be pretty scary sometimes. So we try to make it fun, child-centered, and as pleasant as possible.
What about children that have maybe some disabilities or that are autistic?
That's another part of the pediatric dental specialty. So I had a lot of education in special needs, not just social special needs or behavioral special needs, but also medical special needs. Everything from autism to bleeding disorders, cancer patients, and how to treat those patients dentally in a safe way that's best for the patient.
Sure. Well, you have a beautiful building in here, and I know it's a little chilly out here. Would you care? Would you humor us and give us a tour?
So welcome to Children's Dentistry, and I'll give you the tour.
Cool.
So this is our waiting area. This is where patients would come to check in, meet and greet, our staff. And like I said, we try to make it as child-friendly as possible. So you're greeted with a warm smile, and then you leave with a toy and a prize because everyone does a good job when they visit the dentist. But this is Children's Dentistry, and like I said, it's a child-centered environment, so we tried to make it as bright and colorful as possible so that it's friendly and welcoming when you come in the door.
It certainly is. You know, that's the first thing that caught me was the colors and how this would be something fun for a child.
We try to decorate it for the seasons. We just took Christmas down, so hearts and red flowers will go up in the meantime, but right now we've got snowflakes to get through January. So we try to make it fun and inviting for the children too.
Sure.
Yes.
Can we see some of the rest
I
of the
would be happy to
units?
give you a tour. So,
You know, just to talk and see where the kiddos go and all those fun things.
so this is our auditory bay area. This is where you would come in for just routine dental checkups, cleanings, well visits, you know, consultations. They're easy, fun visits. You know, the beds are spaced apart. We try to separate families, you know, for those COVID guidelines. And there's, you know, a whole screening process, hand washing when you walk in the door so that we meet all of those protocols.
What does COVID guidelines look like right now for you guys? Does it mean that you have to stagger your appointments a little bit more, or how does that work?
You know, I think dentistry as a specialty was always great at infection control. That's one of our strong suits as a profession. We were always wiping down and sterilizing and sanitizing in between each patient. So that was nothing new to us. You know, and where we are, you know, dealing with mouths and spit and all of those things. The masks, the eye shields, gowns, you know, jackets, medical jackets, that was all part of our normal routine anyway. So that didn't really change. And where we are fortunate to have such a large office, you know, being able to space families out and separate it actually was really easy for us.
So it really didn't affect you guys as
Not
much as
very
some other
much.
professions?
No, not very much.
Okay. Well, were your offices closed for a while during the shutdown
We
at all?
did.
Or were you guys an essential service? I didn't know how that would work.
We were considered essential for emergency purposes only. So during that, I actually took a third month off. We could start back in May, and I didn't go back until the end of May just because I wanted to make sure, you know, there was so much unknown. So just to protect our patients and the families of the community, I even took another month before starting back just to see what, you know, the virus and infection rates were going to do. And then when we felt like it was safe to open, we did. And we've reopened safely.
Great. So,
But I'll continue
yeah,
giving
please.
you the tour. So this is where, again, you would come for dental checkup, real quick cleaning, easy visits, consultations, and then, you know, in seating and hand washing areas, like I said, every patient has to get their temperature checked and hand washing stations. So we do all of those things. And we have various private rooms where you could come in again for a checkup, a dental cleaning, and even a procedure. Because, you know, sometimes you need a little time and space for your own procedure. But this is an example of one of our private rooms where we might see some young little ones, or a patient that may be wheelchair bound or have special needs where they need a little bit more space. And back here is the x-ray room. We get our dental x-rays or dental pictures. And every child gets an extra prize on the day that they get their dental x-rays and pictures because they have to be good helpers and go above and beyond so that we can help do our job also. So this is another example of a private room where they would get their x-ray pictures taken because it's comprehensive dental treatment.
These are fun. These
They
rooms
are.
really
It is.
fun.
We tried to make it bright.
Did you do the decoration? Were you the?
I did because, you know, as you open a business, you don't have any money to invest in hiring a designer, so we just did it all ourselves.
What was your? Did you look at other offices, or is this just kind of all your inspiration?
I think, you know, online searching, and I've had a lot of years under my belt, and I've practiced in a lot of states, Kentucky, New York, Mississippi. So I've had the opportunity to work in a lot of different offices and to see what works, what was a great environment for the kids, what the kids enjoyed, what made it fun, you know, and then also to safe, effective maintenance.
What's the kid's favorite thing when they come in here?
Oh, the prize. They always love the prize. You get a prize every time you come to the dentist. And then when you go above and beyond for like x-ray pictures or a filling or something, then you get 2 prizes. And a treat bag, so it's always fun.
I think that all doctors, even when you're adults, you should be able to get a prize if you do good.
And a little happy gas. Sometimes, even as adults, we need happy gas.
Absolutely.
But that's another service that we provide, you know, whether it's, just nitrous gas, happy gas, or a little baby Valium or Versed that we might administer in the office just for patients that are a little nervous.
Well, I'm sure there's a lot of anxiety that comes along with this with some children, and you might have to, put them to sleep possibly for
You
a
do,
procedure.
yes. I have days where I'm at the surgery center in the operating room so that we can provide those services under general anesthesia too.
Sure. And that's probably another specialty that you have that some other people
It is.
might
So
not
we
have.
work a lot with the other doctors in the community, but then there's extensive anesthesia training as a pediatric dentist.
Sure.
So we've got that under our belt also.
That's it's pretty fascinating. I'm sure there's just a lot more that comes with being a pediatric dentist just because of working with the children.
It is. There's medical needs that are, specific to a pediatric patient in addition to just the anxiety and behavior management.
Sure.
So there's a lot. And then, everything from genetic disorders to just the healthy patient and dealing with their anxiety. But there's a lot that comes with it. But I was fortunate to train at those two, in the hospital that I trained, it was the largest children's hospital on Long Island. So we were a level 1 trauma, so I was well versed in the complex medical needs of a patient, trauma, dental trauma of a patient. So I've got a great experience.
Is trauma like maybe getting hit in the face with a baseball or something like that?
Those are things, or your 2-year-old that ran into the coffee table. I mean, I've had to stitch up my little ones too.
Sure.
Yeah, so just little bumps and bruises, and teeth may get knocked out, or a bump or a fall, or maybe even an abnormal pathology where the parent may notice a little bubble in the mouth, or a tissue that doesn't look quite right, or discoloration of a tooth. Those little things, that are all we deal and manage all of those things.
You don't think about a lot of that until you actually need it, and then it's really great that we have someone like yourself in our community, so that's tremendous.
Oh, thank you. Well, come back this way and I'll finish giving you the tour. So, of course, infection control has always been big, so this is our sterilization area where instruments are processed. So, because between each patient, everything is new, wiped down, and sanitized. And so, through this hallway are more private rooms. So, if you had to have, a little bit more extensive procedure than just a cleaning and a checkup, this is where that would happen, so that you've got a little more privacy. Another service that we offer that may be different from other dentists in the community is we do allow parents to come back to the operatory. They're allowed that not just for the cleaning, but they're allowed that for any procedure, whether it be a sedation procedure or just a simple filling. They are allowed in the room.
Is that not common?
Every office is a little different. Okay. A lot of offices do not let parents back for operatory procedures, but we do.
Okay.
I've always trained that way from the beginning in New York. Parents were always welcome in the operatory, and they are still. So you're welcome to come back here in this office.
That's great.
So we'll continue our tour. And these are just more private rooms where patients may have a procedure completed. And every room is kind of fun and colorful, and it's different in its own way. And we have kids that request special rooms after they've been here a couple of times. They know if they want the green room or the pink room or the yellow room.
Oh, you have TVs.
Oh, yes.
Above for the kiddos.
So when they come in, they get to pick their show on the television. And we have, everything is digital and electronic medical record. If we need a little happy gas, we have that available. And every system or every operatory is plumbed, so it's in every room. Because you may start a procedure where you might not need it, and then, you might need it in the end, so it's always available. So we try to be accommodating and offer all of those services. But when they come in, they get, acclimated to the room, they get to pick out their show. It's very child-centered and child-focused in order to complete the treatment.
As it should be, right? So, but this is great.
And we've got rooms for girls too. We've got pink rooms and yellow rooms. This is just another operatory room.
Who designed your logo?
My brother-in-law designed my logo. We wanted something bright and colorful with children, but then also, for the dentistry. Yeah. But my brother-in-law was actually pretty handy because, as you start a business, you don't have anything. You can't hire all those, wonderful graphic designers. But he was very skilled.
That's good.
So he designed it for us, and it's stuck with us. I've had a lot of people compliment us on it.
Yeah, absolutely.
And then this is our STARS room for our STAR patients. And again, we have the nitrous and televisions available. Yeah. Before the pandemic, we had lots of toys and entertainment in all of the rooms, not just for the patients, but sometimes little brother or little sister may accompany the parents to the appointment. So we would have those things available, but since the pandemic, we've removed a lot of those toys and things just to make everything clean and safe. And then after that, so once treatment's completed, you would wrap back around for checkout into the waiting area again. And it looks like we've got some visitors today.
Yeah, I think some of our chamber ambassadors have come over to.
Welcome to Children's Dentistry.
Well, thank you very much for, first of all, being a chamber member.
Oh, I'm thrilled. Now, when we started out in our old Children's Dentistry building, we were up in it was the old Children's Clinic building at the top of the hill, and I only had 2 chairs. So we had no room for growth. But part of one of the benefits, I think, in joining the chamber is you're introduced into the community, like activities like today. And we just had no room for growth. So we waited until we were in our new building.
Well, we're appreciative, and I want to thank you for opening up your office to us today as well. I know that can be an imposition sometimes, so I appreciate you letting us do this. And
we're glad to have you.
well, and again, if people want to get a hold of you, how do we do that? So look at, do you have a website, Facebook? What's the phone number?
We're all of the above. So we're Facebook, Instagram. You can find us on Google. The
Just
phone
look
number
up Children's Dentistry.
Children's Dentistry, and it's Dr. Mary Catherine Carell. The phone number is 606-802-7891, and you would talk to Amber. And we have, our staff is not here today, but we've got a wonderful staff that's fun and friendly. So, and we'd be glad to see you here at Children's Dentistry.
Well, thank you again. And again, we're over here in the Bogle Office Park.
Yes, Bogle Office Park.
Right behind the hospital on Bogle Office Park Drive. This is
just right
the
off
road.
Bogle Street. Mm-hmm.
Yeah, so right off Bogle Street, right next to Commonwealth Cancer Center. Can't miss them. And again, Mary Catherine, Dr. Work, thank you so much for allowing us to come in.
My pleasure.
We appreciate it. Guys, thank you all for tuning in today for another one of our virtual ribbon cuttings. We're going to go outside now. We're going to do one of our famous socially distanced ribbon cuttings out here in front. So, guys, thanks again. Be safe. We'll talk to you soon.